From Flourish DX, this is the Psych Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Welcome to Psych Health and Safety in Canada. And Elizabeth Eldridge is my guest today, and we'll get jumping right in. So welcome, Elizabeth. And here's the question that I have for you. How did a nice music therapy consultant like you get interested in psych health and safety?
That's a great question to start with. I'm delighted to be here, Marianne. Thanks so much for having me. I did take quite a winding road to get to the hat that I wear now. I did a degree in music therapy and then ended up doing specialization. I did my clinical internship after my degree in psychiatric rehab. And that really kind of lit my fire for working with the mental health population. I was mostly in schizophrenia services. And I often wish that I had a real serendipitous kind of moment that I could share with people about this beautiful moment when I knew I was called to do something, something different or something else or something in addition. But in reality, what happened, it was the end of the year or nearing the end of the year. And I had to get continuing education credits. I live in a really rural area. And so I'm Googling frantically, I kind of left it to the last minute and stumbled across some information on this program that was a very new program then called Mental Health First Aid. And I thought, oh, what is that? Sounds cool, but and sounds relevant for the work that I do. So kind of signed up for it without really knowing what to expect. And I was thinking this will be relevant for me because I'm working in mental health. But when I took that course, my mind was just exploding. I thought people need to know about this. And I don't think they do know about it, especially where I live on the East Coast. It was not a well-known program back then. And so I looked into becoming a facilitator for the program, and the rest is kind of history. So I'm coming up on my 10-year anniversary actually as a facilitator for the Mental Health Commission's Mental Health First Aid program. And then sort of went from there in some consulting work and that sort of thing.
That's it. It's fascinating to me how we find our way to this field. So tell us what it was that you think everybody should know from Mental Health First Aid.
Oh my gosh. Oh, where do I even start? How can I say this and not keep you here till midnight? I think the biggest thing that I took away, it was, like I said, I signed up for the course because I was working in a clinical role in mental health care, but I saw a real application for members of the public in the same way that members of the public, many or most would agree that being trained in physical first aid is a good idea. And there's an understanding that that's not a program that's really geared toward medical professionals. They already have, they have a scope of practice. But what can I do as a layperson if I happen to be at the grocery store when someone has a heart attack, right? And I think one of the real challenges around mental health is that generally people are just not super comfortable talking about it, right? So the Mental Health First Aid program, one of the biggest takeaways I feel for people is you do not have to be a mental health professional to have these discussions. You just have to be at ease bringing it up. You can do a lot by just setting the tone with that person who's struggling and letting them know that, hey, I might not have all the answers, but I'm worried about you and I might be able to connect you with some resources that can help. So a lot of it, I think, just we need to maybe do some inward reflection and get comfortable ourselves having that conversation. And for people to take this training, it gives them some language, it gives them those light bulb moments. And I think they walk away feeling like, that's not as big and scary of a topic as I maybe thought it was going to be.
Yeah, it is for sure. That idea of us gaining comfort to be able to be with someone who is distressed and not take on the distress ourselves. I remember, Elizabeth, I used to be terrified to go into a funeral home, absolutely terrified.
Yeah.
And over time, walking with people through end of life and being there, and then understanding that we're not there to see death, but to support those who are living. And it changed it. So all of a sudden, it's not about me. It's about being supportive. And I think that's what you're describing with mental health first aid, is going from thinking, I've got to try and calm this person down. I've got to try to fix them. I got to try and tell them what they need to do, to, oh, no, I just need to be there. Yeah.
Yeah, just to be in that space with the person, right? Exactly. It's funny, I often, when I'm delivering training, I often use the example of being in that line at a funeral home, that very example. Because people are going through in their heads, what am I going to say? I got to come up with something good to say. What am I going to say? And the reality is, you're interacting with folks who have just endured a very significant loss. They are likely going to be emotional. They're going through something really difficult. You're not going to be able to come up with the magical phrase that takes all that pain away, right? It just doesn't exist. That's not reality. But what you can do is make that person feel connected, let them know that they're cared about, let them know that, hey, if you need something, anything, I'm here for you, right? And that's what helps people. It's not, I think we need to stop searching for the magical. A lot of people are fixers by nature, right? Is a big piece of it. So we go into fix it mode and maybe aren't focusing on the human component as much.
Yeah. Now you said, and it's a term that's used in the helping professions a lot, to hold space, but for those leaders or coworkers that don't know what that means, because does it mean I should be 6 feet apart from you? Is it, just stop talking? Can you explain it in your words? What's it mean to hold space for someone?
I would describe it as, I think step one is tuning into our own habits and tendencies that might get in the way. An example I often use about myself is that when I took mental health first aid training myself over a decade ago, I can remember still I'll always remember, because it was such a great learning point for me. The instructor asked, what would be a strategy you would use to make someone feel connected and supported, and to let them know you're really listening to them? And I raised my hand and said, eye contact. You got to have good eye contact, because that lets a person know all of those things. And so that came to mind for me, because I'm a super eye contacty person. Is every person in the universe a really eye contacty person? Definitely not. It makes a lot of people feel really uncomfortable. And especially if this is someone who's describing to you that, hey, I'm kind of going through something tough. So for me, when I'm in that space with a person, I know that a tendency I have is to overdo it with eye contact sometimes. So now I'm much more attuned to what cues am I getting from this person, and how can I meet that need? Another thing that it means to me is being comfortable in silence. This is one that I still struggle with. I also learned in that course, I had always thought of myself as a good listener, but actually what I realized is, nope, I was good at talking. I had some work to do around the listening. Being comfortable in silence is really, really challenging. I always tell, when I do virtual sessions now, as I describe this, I always tell my participants, it's still a thing for me. Like, silence will maybe never feel really natural and comfortable for me, but I have flagged it in myself. And one of the strategies I use, I never facilitate a session without a cup of coffee, because if I ask a question or something, I've sort of trained myself to sit, stop, zip my lips, take that sip of coffee. It's, my way to force myself to let that moment of silence pass, right? So yeah, I think it's, we need to maybe shift our minds from what can I do? What can I say? How am I going to present in that moment? And pan out and look at what are that person's needs, and in that moment, and from conversation to conversation, those needs are likely going to change. So being aware of how the dynamic might evolve too.
Yeah, that's beautiful, Elizabeth. The self-awareness, and it never stops. I just learned what toxic positivity was. and realize that I've been guilty about that. Let's look on the bright side and we can do this. And yeah, it's all good.
Mm.
But when somebody's struggling, the idea that that is dismissing or minimizing their pain, that's not
Mm.
holding safe space. That is trying to take over the space. And,
Mm.
but I also share all your other self-awareness issues that I remember somebody saying to me once, when you look at me, it's like you're boring into my soul. It's like, oh, that must be quite unpleasant.
Oh, that's too funny.
It really is that idea that I see the eyes and I read people through their eyes, and not much less about their body language or anything else. But yeah, I have that tendency to stare right in your eyes because I'm getting information. And it's like, that must be terrible because you feel like I'm stripping you rather than
Yeah.
talking with you. Yeah.
Yeah, a
Yeah.
good friend of mine is she is so uncomfortable with eye contact. If she and I get together and we're catching up, within about 10 seconds, she'll stop and say to me, What? Why are you staring at me? Do I have something on my face? What do so she has really helped me to recognize, yeah, that tendency in myself. What I notice now, especially if she's, venting about something that's difficult or whatever, she really never makes eye contact with me. She'll be talking to me, but she's, looking out the window, or her fingernails suddenly become very interesting, or she's patting my dog as she talks to me. And yeah, it's very difficult. I think part of human nature is it's just part of the way that our brain tries to categorize different things to make sense of the world. We do sometimes end up making this assumption that what works for me must work universally. It must work for everyone, right? But yeah, not always the case.
Yeah, I remember reading, because at this time I already knew about eye contact and trying to, that especially with my boys, that if they were driving or I was driving, that's the best time to have heart to hearts because they can't see me staring at them, right? So it's not
Yeah.
as intimidating. The fact is, I'm still looking at them, whether I'm driving or they're driving, but it's much less intimidating. So yeah,
Take some of
really
the pressure
interesting
off.
point. So lots to be gained out of the mental health first aid when you want to learn better how to sit with and react to somebody struggling with their mental health in the moment,
Mhm.
which I think then transfers to being with everybody.
Mhm.
Yeah.
Yeah, it's so true. And I do a lot of work in the corporate sector, training and consulting work. And I think in a workplace environment, there is an added layer of sensitivity over, these conversations, because in addition to those challenges that we've talked about, there can sometimes also be this feel of, I don't really know this person outside of work, right? This is a colleague of mine. I don't know. Is it workplace appropriate to talk about this? Am I overstepping? And then all the different dynamics in a work environment. If I'm in a leadership role, is this gonna intimidate or make someone on my team feel uncomfortable? Or as an employee, is it gonna make people think differently of me if I, say if I go to my leader, if I go to HR? So yeah, there are so many different moving pieces in a work environment.
Right. And it's also for a leader that you also have to manage their performance. So it's great to be able to have a conversation and the person to feel safe. But then how do you pivot from that to, but yes, the work has to get done. And
Mhm.
that's the challenge that many of them have is
Yeah.
going beyond that. Or what I see sometimes is people who are perfectly fine talking to somebody who's upset or distressed, but giving negative feedback, critical feedback is, completely out of scope for them. And so they leave things undone, unsaid. I notice, Elizabeth, that you're also a certified psych health and safety advisor. So can you tell me a bit about because again, you went mental health first aid is about interacting with one person. Your music therapy is about interacting with one person. Psych health and safety is much broader, much more organizational level. So how did you make that leap?
Yeah, I've basically, it seemed like a natural progression, I guess, after I'd been delivering mental health first aid program and a few other standardized programs for, I don't know, a few years. And I often heard from folks who were there in the training on behalf of their workplaces, this is an awesome course. I wish that we could, do it for everyone. I wish that we could, but, are you able to provide nuggets that I can take back? Are you able to do something shorter? Are you able to, can we have a conversation about how I can frame this to the powers that be and move this forward from a strategy perspective? And so I went on to take some additional training to just look at things through a broader lens. I do a lot around policy development now, which sounds kind of boring, but it's super, super interesting work. It's policy. I'm a real nerd, I guess, in finding policy interesting, but to me, it's a place that really makes sense for workplaces to start, because it's not to say that there aren't exceptions to situations, but a big fear that I hear from clients is you don't want people in your workplace to feel like there's favoritism happening. You don't want people to get their backs up about, well, why does this person have access to this, or why is that person taking shorter breaks, or why is this? And so policy is a really great thing to have to guide the decision-making process, right? And then policy feeds in a really direct way to culture, right? Which we know is, of course, one of the main factors in creating a psychologically healthy work environment, right? So when that focus is on equity and giving people the tools that they need to be successful in their roles, it's I often frame it as we're redefining fairness, right? When employees are saying, well, that's not fair. Why is this person doing that? Or why does that person get that? Fair doesn't mean the same. Fair means recognizing that every human being is a different human being. We all have different strengths. We all bring different things to the table, right? And then likewise, we also have different areas where we might need a bit of extra support. So I think when employees feel like, hey, that's great, my needs are going to be met by my workplace, that's the impact on culture there is huge.
So what do you say to the leader who says, well, if I do this for one, then everybody's going to want it, and so I don't want to give an inch? The idea of accommodating and being flexible is terrifying
For some leaders.
Well, I would say, so as a policy geek, I would first point to some really awesome evidence that shows that that's simply not true. And I mean, if we use a mental health, physical health comparison, is there such thing in a workplace as someone calling in and saying, I can't come in today because I have a stomach bug, and they don't have a stomach bug? Of course that exists. What research tells us is that, we are far less to see that when it's related to mental health than we are to physical health, because unfortunately that stigma around mental health prevents people who do need support from voicing it, right? But we know that, we certainly can't go on the assumption that there are, that every individual who asks for support is abusing the system. That's factually untrue. But some really great emerging literature is showing that, taking a proactive approach, taking these situations seriously, and the step beyond to take steps to mitigate risk of psychological distress insofar as we have control over it, really, really strong return on investment for employers. So there's lots of evidence that supports that. But I also like to add in there, we could talk about the dollars and cents of it, but it also speaks to, the bigger picture when we think about how many hours of our days, all of our days, are spent at work. Don't we all want them to be nice places to be, right? It benefits everyone. They're one of my favorite leaders who passed away a number of years ago, but Tony Hsieh, who was the founder of Zappos, the online shoe store. He was this really innovative thinker around leadership. And the culture that he created was one that was just so unique and interesting. I could go on all day about it, but one of the big takeaways. So of course he had to convince some folks that some of these measures he was putting in place were smart ones, because look at the ROI, and here's how we're going to measure it. Here's the KPIs we're going to use. But at the end of the day, he said to his stakeholders, not everything is measurable. What's the ROI on hugging your mom? Isn't that a great quote?
Yeah.
So, I think part of it has to be, yes, the numbers are there to support that investing in psychological health and safety. It's a really, really strong, smart investment for employers. But I think we need to be conscious of the human piece too. Like, as long as we're employing humans and not robots, there's I think an ethical piece that we need to have on our radar as well.
Yeah. Well, we talk to employers. We say, well, how do you measure the ROI of occupational health and safety? You just do it. It's risk management. So you're not doing it to save money. It's an investment to save risk and hazard. And we can look at things like turnover and conflict and absenteeism, that there is a risk that it's going to get worse if you don't manage psychological health and safety. So yeah, that conversation, Elizabeth, has been an interesting one over the years, because ROI, because of all the confounding factors, is very difficult to prove. But yet, when we look at the evidence that it can reduce conflict, it can reduce grievances, it can reduce turnover, there is definitely an ROI, but it's just tough to say it's specifically because you did this.
Right. Yeah. That's always the challenge. I think it could be. I'm really interested, as I'm sure you are, in seeing how the pandemic changes the approach. Like I've seen some changes already, but I think when we get into measurables post-pandemic, that's going to be an interesting piece, because we knew even prior to the pandemic, we were seeing a shift in the workforce and the attitude of younger workers. Like millennials, we know, are the first generation of workers who will take less money for things like better work-life balance, working for an organization that they feel connected to and that reflects their own personal values and has a mission that they believe in. The workforce had never seen that before millennials.
Well, I'd like to say thank you for the compliment, because I've raised some of those millennials and they're smarter than we were. And that's why they're doing it, because they understand about quality of life. So yes, thank you very much, Elizabeth, for the compliment that I did a good job. And yet I get my backup with the statements that millennials are entitled. Both my own children and their friends are very hardworking, very dedicated, but they're just not blindly obedient. They're not going to take abuse. And that's, to me, much smarter than those of us who are raised to just do as you're told.
Yeah, it's so true. I think the days of, just close your mouth and be happy that you have a job are like, those days are kind of behind us now. Right. So I think there's maybe a bit more, how will I phrase it? Maybe healthy pressure on employers to meet a need that is just, it's the reality of the candidate pool, right?
Well, yeah, it's a relationship. And it at one time, I think they thought, well, my half of the relationship is I pay you. But as you've pointed out, that's not enough. Elizabeth, you also said you've already seen some changes because of the pandemic. Can you describe some of those?
I think the human piece of work life is maybe appreciated in a way that it previously hadn't been. I'm going to use myself as an example here because I'm in a work engagement right now while my dog paces behind me, and maybe listeners will hear her little toenails clicking on the floor. But as people had to adjust during the pandemic to wearing all of these different hats, like suddenly you're not just an employee, you're also a homeschool teacher, or you're also like you're trying to work from your kitchen table while your spouse and your kids are trying to share that internet connection as well, and you're having. So I think leadership maybe developed an appreciation because they were going through the same things as well, right?
Mhm.
And so in some sense, it put people on this even playing field, that there was an understanding that we are all human beings and we are all struggling in some way. We are all weathering the pandemic in different ways. And I'm hoping that that's a feeling that rides through when COVID-19 is just a distant memory for us. This understanding that, like I say, just the human piece, I guess. I think maybe we're talking more openly about mental health as well, which is a really positive thing. But I've also been emphasizing to my clients, stigma does still exist, right? Like we're talking about it, but we've also got to walk the walk, right? Some maybe long overdue conversations have been happening because mental health sort of came to the forefront for a lot of us during the pandemic. But we need to find a way to continue those conversations on, and if we want to make sustainable change, there has to be action. It can't just be conversations.
Yeah, I remember somebody saying to me, well, how am I supposed to notice on, a video chat that somebody's mental health is, that they're struggling? And I said, well, if we make the conversation every day for at least a few minutes about how are you coping? How are you managing the stress? What are you doing for your well-being? If that becomes normal as part of our team discussion, you'll notice when their answers are changing, when the way they respond to that is changing. So you don't have to see something really startling to be able to recognize. Yeah.
Definitely. Yeah. It's part of being proactive, right?
Yeah.
And when it gets to a point where we can have these conversations no differently than we would talk about physical health and in a work environment, right? I think that's when we'll know we've really taken a giant step forward.
Yeah. Now, so these are the things that you've seen already. What do you hope to see as people start returning more to the workplace and to whatever our new normal is going to be?
Hmm. I'm hopeful that we'll all start putting some boundaries down. I think for both leaders and employees, we really need to think about what work-life balance looks like and where our boundaries are. And I think employers rather are going to need to be a little bit flexible. They've been flexible for these past couple years, but hopefully that doesn't, come to a hard, fast end. Flexibility has really worked well for many employers. Certainly, I would say the vast majority of my clients have said, why didn't we do this sooner? Why did it take a global pandemic for us to say we can meet your needs better than we have been? There are a lot of work environments, for example, where the 9 to 5 Monday to Friday work day isn't really, like, having those set work hours isn't really necessary. Someone made that up a long time ago, that this is what the workplace is, or the work week is going to look like. And so a lot of employers said, oh, okay, I guess we'll do that then. But there are norms like that I think we can examine and say, is this necessary? Does every person have to be in the physical workspace Monday to Friday, 9 to 5 in order to accomplish what we do with this organization? And if the answer is no, then what different shapes can flexibility take, and what employee needs can we meet by being flexible? A great example of that flexibility, I had a great chat with a client the other day about changes that they're making to medical documentation that they need in order to make accommodations. We had a conversation previously about how some employees who were in need of accommodation who didn't have a family doctor were having a really hard time getting the documentation needed in order for the accommodation to be made. And then we know statistically what's likely to happen is not that that employee will wave their magic wand and say, okay, I won't be in mental distress anymore, right? If we're not providing the necessary accommodation to support that person in getting well again, things are not going to be a whole lot of fun for that employee, and there's going to be perhaps an impact for the employer if things worsen to a point where this person ends up needing time away from work to get better. So this was an HR professional, and she said to me, I just had a really frank conversation with leaders and said, do we really need a doctor's note that says, oftentimes it says stress. And that's it, like lots of times that documentation isn't super in-depth anyway. So are we just doing this because that's the way we've always done it? Or is it maybe time to re-examine it? And so instead their approach now for, not for major significant longer term accommodations, but in those early stages to come to the table collaboratively with that employee and say, hey, we're so glad that you flagged for us that we can do something to support you. So let's talk about what that looks like, right? And there's a really warm, fuzzy vibe right from the beginning, right? The employee feels a whole lot more at ease because they feel like their needs are going to be met, like their employer's understanding and really willing to help them in a genuine way. And that's probably going to yield a better outcome for all involved. So I'm hopeful that that kind of outside the box thinking will stick around post-pandemic.
Do you know, it was over a decade ago that Dr. David Brown, who was the medical officer for CIBC, came up with that approach saying, we don't need medical unless it's very expensive or it's going to put an unfair burden on other people. Like you say, there's exceptions to it. But he found that the cost to the employer, because people weren't chasing. I remember one occupational health nurse said she felt like the paper police. That's all she was doing. Instead of helping people, which is why she became a nurse, she was just chasing them for documentation and paperwork, which was stressing them out more. But the problem is that employers sometimes think, well, they're going to ask for the sun and the moon and the stars. And, I'm supposed to just say yes. But if we can help employers to understand how to tie the accommodation to how will this help you do your job through this time, then you're really not worried about it. Because if there isn't an argument that it'll help me do my job, I just like to have Fridays off. It could be, my energy level is such that 8 hours a day doing this concentrated work is difficult. If I could do 6 hours and I'll do a couple at home, after I've had a bit of a rest, there's lots of creative solutions if we would just be open to them.
Oh, it's so true. And I think another huge benefit for the employer is that it helps them to see that their position doesn't have to be coming up with some way to get this person better. Right? Like instead, you're empowering that employee to really think about what their needs are. And of course, who's going to be better positioned to figure out a solution, right? The employee who's actually going through it, or, someone acting on behalf of the employer, right? So if you can, I think empowerment is so key. We know that that's key in the recovery journey from mental health issues anyway. And then to have that stress alleviated for the employee, that, when you see that collaborative attitude coming from the employer, that really speaks volumes. And like you said, I think just keeping your eye on the long-term goal, like the accommodation ideally is meant to be a roadmap to support that person in getting back to being able to do their job in a way that's satisfying for them, satisfying for the employer, satisfying for everyone. But I've seen, as I'm sure you have, where things can go awry is when an employer doesn't really know how to navigate this. And instead they kind of throw their hands up and say, well, I guess we just have to accommodate. So do whatever, I mean, that of course doesn't make the person feel supported, and it's not solution focused, right? So you both want to be working together toward that common goal.
So that win-win situation,
Mhm.
that's good for everyone.
Yeah.
I have to ask because I'm curious. Tell me a bit about musical therapy, how it works, what it does, and then is there a place for it in an organization?
Mm. So I do actually I wear a bunch of different hats, and I do still run a music therapy practice. I don't do any clinical work myself, but I tell the music therapists on my team that I always get really jealous when we're talking about, their clinical experiences and things. I always think, oh, I wish there were more hours in the day so that I could still do that really awesome work. Music therapy is not a brand new field. But music therapists across Canada are now sort of breaking into populations or working in environments that they hadn't previously. And the pandemic has been, I think, a piece of that. A lot of music therapists have been delivering virtual services, for example, which, pre-pandemic, we would have thought, well, how do you even do that? But I think in a work environment, certainly there are applications for people to learn of the health related benefits that music can bring. When we use it intentionally, it can really yield tremendous benefit. So an example that I often use, we've probably all had that experience where maybe we're feeling kind of tired or stressed or not in the best mood. And we get in the car, we're on our way to work, and oh my goodness, my favorite song just came on, and our toes tapping and we find our spirits lifting. So most people don't have a hard time understanding that that connection to music that we all have. What a music therapist can do is take that and really harness the power that music holds. So in a therapeutic relationship, it's done with a whole lot of strategy around it for pursuing non-musical goals. I was chatting with a music therapy colleague recently about some of the very cool work that she's doing. And it's not related to a workplace setting, but just to give you an idea of what diverse populations music therapists can work with. So she is working with patients in a hospital setting who are recovering from severe symptoms of COVID-19. And we know that reduced lung capacity is one of the longer term challenges in those more severe cases. And she's working on a team with physiotherapists and occupational therapists. And what they were doing with a lot of these clients, there's a device that you breathe into to measure your lung capacity. And she is working with these clients to teach them how to play the saxophone, something they wanted to do since they were a kid, but never had time to do. And so, they're measuring the benefit, right? Their lungs are getting stronger as a result of this work. And so it's just a really cool example of how that, I guess it does sort of tie in with what we were talking about, the outside the box approach, right? Can yield huge benefits. So when you throw in an enjoyable experience on top of just, breathe into this thing 10 times a day and we'll work on improving your lung capacity, the person might not be as motivated as if there's something enjoyable happening as well. So in a workplace environment, certainly having the skills of a music therapist who might even come in and just do a short session on a wellness Wednesday or something like that to your team about how to harness some of the benefits of kind of the premise is that, am I saying the plural version right? I don't know.
More than one premise, yes.
Okay, more than one premise that a music therapist might use in a clinical setting. How can you take some of those principles and apply it to your own relationship with music for things like stress reduction and improving your sleep and things of that nature? If anyone is, oh, I'm sorry.
No, go ahead. If anyone is.
I just wanted to throw a shout out to a music therapy colleague of mine, Jennifer Buchanan, who's based in Calgary. She's done pretty extensive work in the corporate sector and in exactly what I was just describing. So her practice is called JB Music Therapy, and yeah, she's very, very skilled in that area.
Yeah, it's fascinating. I am always interested. I worked with somebody who would listen to music with lyrics while they did reports and wrote emails. I can't possibly do that. It's just divided attention. And then I know a lot of people who like the background instrumental music while they work. They find it very soothing. I find it very annoying. But I have monkey mind, where I'm always in my head and always thinking. And the one time I'm completely out of that is when I'm listening to live music. There's something different about live music for me, and probably because I'm connecting with the artist as well as listening. And yeah, but I think everybody has a relationship to music, and they just have to figure out what it is and how it can transport them. So that's fascinating.
It's so individual, eh? I
Right.
mean, musical preferences. And I'll tell you something that I find so fascinating about what you mentioned around live music. It releases when we're in a live music setting. It's one of not a whole lot of different activities that we know about in modern society. Other than pretty intense moments like childbirth, for example, where this huge onslaught of oxytocin is released, which is the big, it's the love hormone in our brain. It's this big social connector. And where that comes from, it's based on this biological need for connection that humans have. And if you think back to cave people days, when did people make music together? It was when all was good, right? If your basic needs were not being met, you weren't engaged in music making, right? It was used as a celebration and sort of signifying that, hey, we're doing all right. And so how that translates today, it is still, this connector, and there's this association that life is good, right? Like oftentimes I hear when people are in live music settings, you can see the look on their face that's exactly how they're feeling. This is awesome. I'm right here. I'm in this moment. The folks who are around me who are singing along those same words. Yeah, it's a pretty unique bonding moment, eh?
Yeah, it is. It's fascinating. But now you've made me understand it differently. So I feel like I'm in love and that life is good when I'm listening to the live music. That makes sense to me, Elizabeth. Yeah. I think I'm going to enjoy it even more now. And it's
Yes.
finally starting to open up again that we can have that experience one more time. I can't believe that we're going to run out of time here because there's so much more to cover. So first, I'm going to put it back to you. Are there other messages around psych health and safety that you would like to share with the listeners?
Oh, I would say like my biggest kind of tip, I guess, in going forward is it can seem something I hear a lot from clients. There's so much literature out there right now and a lot more discussions than ever before about the importance of mental health at work. And it can feel daunting, right? It can feel like, where do I even start? My first recommendation is to start somewhere. That's important, right? Don't think it's too big. I don't know. We can't fit it in. We've got a lot going on here. We can't fit that in today. Start somewhere, right? And what typically people will see, or organizations will see, you take that first step and you see oftentimes it's a really surprising impact from even just small initiatives, right? So then that kind of spurs you to take that next step. But my recommendation is to make it, and you touched on this earlier, but just making it a cultural norm to talk about these things. We don't have to wait until we're in a challenging position as an organization to take mental health seriously, right? If things are good right now, that's a great day to talk about mental health. If things are not so good, that's also a great day to talk about it. But some of it just takes time and patience and consistency, right? If your team is meeting regularly, set 15 minutes on the agenda to talk about, things are stressful right now. A reminder that we have access to this fantastic employee assistance program, and here's what that looks like, and here's how you connect with it, and just to set that as a norm. I tell my clients, if you ever get to a point where everybody can rattle off that 1-800 number for the EAP and they're going, yeah, we know, then you'll know that you've done your job. But it takes lots of repetition, lots of consistency, and just some time for people to adjust to it. For sustainable change, we know that we have to be patient.
Yeah, but those small steps, that embedding it in the way we interact on a day-to-day basis, that is the best way to make change. Even though the policies, the programs, the bigger initiatives are great, they only exist so that we change the way we interact on a day-to-day basis. So
that's exactly it.
Yeah. And Elizabeth, this is a question that I like to ask everybody. If you had to explain psych health and safety to someone who doesn't know anything about what it is, and I know that you know the formal definition, but if you're trying to paint a picture for what does it feel like to be in a psychologically healthy and safe work environment, how would you describe that?
That's a great question. I feel that it is taking care of the whole person at work, right? Recognizing that we are more than just a beating heart and inflating lungs and all of those different bodily processes. That, if we're employing humans, we need to understand that humans have complex needs, and caring for human needs means something beyond just physical health and safety. So in a rainbows and unicorns workplace, where, an organization that has really prioritized psychological health and safety, people feel genuine purpose in coming to work. One of my big measurements, I often start by asking a client, can every person in your workplace tell me what the organization's mission is? And that seems so basic, but oftentimes the response I get is, well, leaders could probably say it, but maybe not everyone. And part B of that question is, can every member of your team describe to me how the work they do serves that mission, right? And I think, like we talk about employee engagement and how do we get people to be engaged. If we approach it from a more genuine place, and a lot of culture is a big factor here, but when it's a really, really good fit, an employee believes in the work that the organization does, and they feel like it's a reciprocal relationship, right? And so the employer doesn't believe that, like you said earlier, that, well, I'm paying them, so that's what they get out of coming here, right? The employer sees that part of their job is to support their team members in feeling genuinely rewarded by the work that they're doing. And then the other piece of it, the employee is naturally going to be engaged, right? So it doesn't mean that we're going to spring out of bed singing a show tune every single day of our lives, right, as we're going to work. But at the end of a work day, we leave with a sense of satisfaction and feeling like we added value and we put something out into the world that was of use, that was beneficial, that helped someone or something. And, we can pat ourselves on the back for having done that work, whatever it looks like.
Yeah, whatever it looks like, because if I'm just saying, would you like fries with that? If I feel like I'm providing great customer service and people that work with me are telling me that I'm doing that, I can feel good about it, even if it's a minimum wage job. It's and then maybe I will go on to find something that pays more, but I'll say, yeah, I had a great experience while I was with that company. Yeah.
Exactly. And, if we think, my brain goes back to that policy place, but if we think about retention strategies, if I start out in a minimum wage position with this organization, and I feel like I can bring my authentic self to work, I feel valued and appreciated by my employer, I might end up earning more than minimum wage and change positions, but it's likely going to be with that same organization, right? And then engagement just builds and builds and builds over time. So that's great for everyone. That's another of those win-wins.
Well, and that's another ROI that's tough to measure, right?
Yeah.
That commitment, that loyalty, that wanting the organization to succeed is a great investment if you can get people to feel that way that are working for you.
Yeah.
So,
I tell people that it's hard to quantify it, but a really valid measurement of engagement and culture is, what would your team members, if you were in an environment where your employees were gathered around with some of their friends or family members in, a non-professional setting, like they're grabbing a beer with friends on the weekend or something like that, and you were a fly on the wall for that conversation, when so your team member is there and their friends are griping about their boss and, oh, this has been the longest week ever, and so on and so on, what would your team member say? And, I find that leaders can guess what they would say. They don't actually have to be a fly on the wall. They kind of already know. And so, although it's hard to quantify, that's a good measuring stick to start with.
well, and that's a good motivator too, Elizabeth. So I think we'll end on that and hope that every leader now is going, wait a minute now. And that they think both about what they might say and how they might change that for the better.
Oh, that's great. I'm so grateful for your time, Mary, and thanks so much for having me. I'm such an admirer of the fantastic work that you do.
Oh, well, that's very kind, Elizabeth. Thank you for the work that you're doing. And thanks for being part of this. There's been so many little nuggets of wisdom that you've shared that people can take away. And that's the whole point of this, right? Helping people to think a little differently, to be able to take practical action. This whole podcast will be on the psychehealthandsafetycanada.com website. And when it's first released, it will also be promoted on LinkedIn. So I'll get in touch with you then, and you'll know that you're out there for the world to be inspired by.
Oh, fantastic. I can't wait.
All right. Thank you so much.
Thanks, Marianne. Have a great day.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.